All right, thank you so much for keeping it NBS Television and welcome to the Morning Breeze. Once again, we continue to give you what's happening in and around the country. But do not forget to watch NBS TV and the Morning Breeze on the Afro Mobile app. You can stream live, you can play, pause and rewind. And you can also be able to chat out with your favorite TV host and your friends on the Afro Mobile app. We continue to remind you that the future is now. Do not wait for another future. It is right here with you. Just your phone. You can be able to watch television, listen to radio, and everything else will be sorted. Once again, my name is Mildred Tohaise, and welcome back to the Morning Breeze. At such a point, we take you across the country to find out what is happening, and we'll start off from Bukoma Nsimbi, where Zainab Namusazi is standing by the Butenga Health Center for ardently tending to patients. But there is a lot more that needs to be done. Now we're talking about the doctor's strike. We're talking about supplies that they are complaining about. What more can be done? Zainab Namusazi, tubulire ebifeeyo mu byobulamu.
Nansanya Midrid ene Bukoma Nsimbi ebyobulamu bitambula bulungi kuba wotuuka ku Doria district ekkulu erya Butenga Health Center for olaba nga ate abasawo bali mu keeja agokulaba nga batuusa obuweereza ku bannabukoma Nsimbi ababa bwetaaze era nga ku ddwaliro lino yadde nga lirina dokita omu yekka wabula naye sijja gavumenti no yagenze mu kwegugunga kubanga okuva abasawo lwe balangirira okwekalakaasa kwabwe dokita ono buli lunaku gyali ku ddwaliro nga n'amalwaliro amalala amatonotono ag'amagomboola oba ge bayita zi health center 3 ne 2 nago bw'otuukayo olaba nga ate ebyobulamu bitambulira ddala bukwaku era nga n'abatuuze bw'oyogera nabo bakutegeeza nti nno bo bafuna empeereza era abasawo baba bulungi empeereza nga bwe bagyagala wabula Midrid musaa kino n'ogolaba ndi ku Lusegeye RDC wa district eno ey'Ebukoma Nsimbi omukulu Bakunda George kayogera ate ye ku kwekalakasa kw'abasawo okulungudde kati ebbanga lya nnaku nnya RDC abasawo bagenda mu kwegugunga ku ntandikwa ya sabbiiti eno okwekalakasa kuno gw'okwogerako ki olaba nga kugenda kukosa batya empeereza eri bannayuganda.
Zainabu mbalamusiza abantu mwena ab'eggwanga abampuliriza ku makya ga lwaleero balamusiza nnyo ababukoma Nsimbi naye mbeebaza emirimu gyonna eyimukola naye ekyebasawo n'okwegulumula n'okwekalakaasa njagala kwebaza abasawo baffe ababukoma Nsimbi mbeebaza nnyo tebagenda mu kwekalakaaswa babeera ku mirimo bakola obuweereza bugenda mu maaso n'abadokita baffe abakulu tulina abadokita babiri mu disitulikiti yonna naye abaweereza abalala b'ebyamagara baliwo ku mirimo gyabwe mu malwaliro gaffe ag'ebyalo kwegamba aga health center 2 ag'amagombolola health center 3 erya Butenga erya health center 4 abaweereza baffe webali bakola baweereza obuweereza abantu nkubiriza abantu mwena ababukoma Nsimbi abitundu byenjawulo mbakubiriza omulanga mujje bangi ku bitundu byaffe ebyobuweereza webuli mutunge obukatu bwammwe babakuba empiso ku bukatu obw'okujemebwa obulwadde buno butusoomooza ng'eggwanga obwa COVID-19 twagala abantu mujje bangi eddagala tukyalirina vaccines tukyazirina twagala mujje bangi olunaku luno n'enkya wamukaaga ne Sande tugenda kukola mutunje obuweereza obw'okugemebwa tugende mu maaso n'ebyemirimu gyaffe. Nsiimye nnyo gavumenti yaffe n'omukulembeze w'eggwanga okukola kyona ng'ekisoboka okutungira vaccines ez'okugema abantu baffe.
Tanzania RDC ebisingako ku byobulamu tujja bireeta amawulire gaffe agaddako. Midrid embeera bwetyo bw'eri Bukoma Nsimbi n'izogamba nti ffe tuli ba mukisa wabula olwakadde kankomewo gy'oli mu Political Command Center.
Bwe tweyanziza nnyo Farish Magembe webale nnyo Zainab Namusazi ndowooza ku Farish Magembe kubanga gwe ngenda okubeera nga atenzirako okwogera naye tulaba ate ebigenda mu maaso mu bendo ly'e Masaka. Farish kirabika onkedde oli ku bwongo bwange atubuulire biki ebifa e Masaka.
Midwe twasoyo tya ate nalaba NBS enkya ya leero kituufu nnyo nnyini ddala okuva ku ntandikwa ya sabbiiti eno ku Mande abasawo lwe baatandika okubanga balaga obutali bumativu bwabwe okwetoola eggwanga lyonna olw'okwagala okwongezebwa ku nsako yaabwe. Kyenza okugamba nti oba oliawo ekitundu ekimu ku byakosebwa ly'eddwaliro lino ery'e Masaka Regional Referral Hospital. Ku ssaawa we nakeererawo ku ssaawa emu ate n'okutuuka ku ssaawa nga 8 kyali kizibu okulaba ku musawo omukugu yenna ali ku mutendera gwa dokita abali mu kulaga obutali bumativu ate era n'olunaku olwaddako kyali kizibu okulaba omusawo wabula olunaku lw'eggulo abasawo abo badokita baalabiseeko naye nga bakola mu nkola gy'oyinza okugamba nti erimu okwebuzaabuza babadde tebalabika badde bali mu leeya abamu nga kizibu nnyo okulaba dokita nga bw'aba ayambadde oyinza obayita abalwadde naye ng'obuyambi eri abalwadde babadde babubatuusaako. Wano wendi ndi ne amyuka RCC w'ekibuga kino Masaka omukulu Ahmed Katerega Musaz agenda okuba nga atunyonyoleramuko RCC ekibuzo kankyete butereevu gy'oli mwakoseddwa nga ekibuga ate era wembate mwakoze eki okulaba nga abasawo bano badda ku mirimu okubanga nga bukati we twetandise okuba nga tubalaba?
Okutwalira wamu tetwakoseddwa kubanga yes badokita abamu balabika nga bakozeemu mu ngeri eyo naye si bonna abalala basigala nga bakola emirimu ate twateekawo ttiimu okwali RCC yennyini mukulu Stephen Asimwe ne Disowa Mutfe ne secretary owa social services era nga ye deputy mayor ne bakwataganira wamu ne director yennyini Dr. Onyaiti ne baba nga boogera bulungi ne badokita okukosebwa tekwabadde kwa maanyi era okutuusa eggulo tewabaddewo obuzibu buli awo. Fact eggulo era bazzeemu ne baba adressinga nekiba nga kyabadde kitambula bulungi ate nze nina badokita be nabadde ntambula nabo eggulo nga tulambula engeri okugema kuno kwa COVID-19 gye kugenda era nabo twabadde tukola bulungi. Yes babadde balina obuzibu naye ekirungi bakama baabwe oba bakulu baabwe mu kibiina ekibagatta badde basinkanye president n'abasuubiza nti bye baagala bigenda kuteekebwa mu bajeti y'omwaka gw'ebyensimbi ogujja nga buli dokita ajja kutandikira ku bukadde 5 okudda waggulu. In fact bantegeezezza bano badokita nze be nabadde ntambula nabo nti ekigendererwa kyabwe ne mu Uganda yonna si kwabadde kwediima ng'oku naye buno bwe budde obw'okukola bajeti ey'omwaka ogujja
nabo bateebwemu
nti kati bw'otakolamu katiisa kati minisitule y'ebyensimbi eyinza okwerabira teera kye babadde bagenderera bamaze okukifuna naye wano ng'e Masaka tetwadde okukosebwa kw'amaanyi kuliawo.
RCC tweyanza nnyo n'ebyemwagezezaako okubanga mukola okulaba nga abasawo baddamu okubanga badda ku mirimu. Mildred kyayinza okakasa kiri nti kati mu kaseera kano ku ddwaliro ekkulu e Masaka embeera yazze edda mu nteeko abasawo abasinga abakugu badokita bazzeemu okubanga bakola ekyabayi obuyitibwa bwabwe kubanga abasawo batugamba nti kuno kubeera kuyitibwa. Mildred twongereyo n'ebirala ebifa mu ggwanga.
Bwewaawo tweyanziza nnyo Farish Magembe kuyitibwa naye ate nabo bantu beetaaga kasente bagenda malwaliro gegamu. Actually, as we continue with this discussion about medical doctors strike, it was very, very painful when the current UMA president, Dr. Oledo, talked about the fact that many doctors provide services that they themselves cannot even be able to afford. That was very, very disheartening. But anyway, let's continue to track up on the doctors' strike in Lira, particularly. Isaac Otui is here to give us an update. Isaac, any change? Do we see a few doctors returning or still the same as it was on Monday?
Well, good morning, Mildred and the viewers of NBS. We are coming to you live from Lira City. I've been able to speak to quite a number of district health officers across the region, and some maintain that the strike is ongoing and they're striking, but others say they won't be joining the strike. Here I have been joined by the district health officer for Lira, and he says they are striking, but also taking into consideration that they must protect life. No life should be lost because we are looking for how to survive. Dr. Bushan, you are welcome. We are live on NBS. What's different that is happening in Lira district?
Oh, thank you very much. In Lira district, we have not changed the status quo, meaning that we are rendering services to the communities that we have been serving, aware that we are dealing in a difficult situation of COVID-19 pandemic. And even if there is a nationwide strike, we have maintained that we should continue delivering services, especially medical and surgical emergency services. And so I'm happy that since midnight of Monday to date, we have been delivering our services. We have been training our staff on other health intervention strategies. Recently, we have just concluded a meeting on lymphatic filariasis, and our doctors were there, and we have told them no, life number one. And aware that Uganda Medical Association also conforms to the International Federation of Medical Association. They know very well the guideline of industrial action, that even if it is being carried out, life must be taken as a priority, meaning that no one should lose his or her life. So every patient has a right to access to health care, especially when they are in emergency situation. So this is the situation in Lira.
This strike is all about your welfare and inadequate PPEs at the facilities. What is the situation in Lira district? Do you have enough to give care to the communities?
Well, as far as Lira is concerned, I'm happy that Ministry of Health has been in touch with us. And right from the time when COVID-19 pandemic was pronounced a public health emergency by His Excellency the President of the Republic of Uganda. And since that time, we have been receiving a number of PPEs. And I am happy that we even were able to receive the cotton,
because of
PPEs.
time, we shall have to look into this later.
Yes.
Very good morning, Mildred. This is the DHO for Lira District, Dr. Busha Nochen. And we shall be talking more on seeing how we can give our communities care and health services. Back to you, Mildred, at the Political Command Center.
All right, thank you very much, Isaac Otui, for that update. Still, we are looking at the doctors who have decided to say, until you come forth on your promises will not come through. Simon, a very good morning to you. And like the statement I said while you hosted the UMA president, being able, it is like the time you were talking about waitresses at a particular restaurant who seemed to envy you as a customer because they're serving what they cannot even be able to afford.
They watch you drooling. They actually drool, salivate at what you're eating.
Because they cannot afford it.
With a lot of envy. But this is the wait or waitress who's brought the food from the kitchen. That's the kind of unfairness that is.
So it is same with the doctors, that they're providing services that they cannot afford themselves at some point.
What happened to the days where being a doctor was prestigious? They really had unlimited access to health care back then. By the way, I wish we would at least revive a bit of what public service meant then. Public service back in the day meant if you were a teacher, your child had automatic scholarship wherever you were teaching. So education was free. It was a guarantee. How do you tell me today that someone is teaching your child, but their children have been sent back home because of school fees?
And you expect them to give
And you expect them to teach you.
But anyhow, remember the times when there would be strikes and people are told, go rear goats? Or it is at your own risk?
Yes.
It is the same message that the director of Gulu Regional Referral Hospital is actually bringing and saying, you're laying down your tools at your own risk. Remember the time we were also promised Cuban doctors?
Yes. And there was a time when we wanted to employ military officers into schools to teach.
We've had lots of threats coming through, but let's go to Gulu and find out what next if they continue laying down their tools, according to the director. Well, Benson Ngome is here to give us the details. Benson, good morning and over to you.
Well, a very good morning, Simon. Very good morning, Mildred. And definitely we're talking about the intern strike. And joining us this morning is Dr. James Elima, who is the director at Gulu Regional Referral Hospital, the only regional referral hospital in Acholi sub-region, crossing a bit to Lower West Nile. Good morning, Dr. James.
Good morning, Ngom, how are you?
I'm okay. How are you doing with the doctor's intern? And I saw you saying people who are not willing to work go and wait from home. How are you doing?
Yeah, definitely there is a gap, but I think we are covering up the gap. And we also have doctors from the university, Gulu University, who are covering the gap. We have our own doctors. We also have doctors posted by Ministry of Health for COVID activities, and they are covering up the gap. But the gap is still there. That is true.
How you definitely could even see how patients have come, and the patients are probably waiting for maybe services. Maybe have you had the communication with them, especially the one who are at this facility?
Yeah, they provided us with a written communication, and we said, well and good, if it is organized by your federation, that is what you have taken up, but we still urge them to come back and work, and they have not shown up.
Yes, senior doctor, there have been a lot of debate about services of doctor. Do they need to go on strike? Do they need to have a conversation with government, with stakeholders? You're very senior doctors. What is your thought about it?
Well and good. In my own opinion, definitely I would not take that route. But unfortunately, the interns have taken that route of industrial action. If I were them, I would ask, should I do that? Morally, is it acceptable? And should we leave patients to wait like this for all this time? But you know, rights are rights. They say they are discussing their rights. But also rights have limits. The patients also have their rights. Yes.
You sit at the helm of a facility like this, Gulu Regional Referral Hospital. You manage doctors, you manage nurses. At your level, doctor, do you think also government, because, and this is your opinion, do you think government has done enough also to consolidate these grievances?
Yeah, government has tried, that is true. If you see over the years how this salary has evolved, so many salary reforms have been done, actually public service reforms, one of them is salary issues. It has been done over the years and it has improved comparatively to the region. But however, we should not use medicine as a weapon, you see. We should not use our labor as a weapon. We should negotiate in a civil manner and do things the right way. Yes.
Okay. Lastly from me before I hand over to, which money do you think is a profit for medical doctors?
Pardon? I don't get you.
How much do you think is a profit for medical interns?
Yeah,
from their wishes?
They approved, the president gave a directive of 2.5 million shillings. And I think that is appropriate at the moment because that is the same money a medical officer earns. Yes.
Thank you so much, Dr. James Lima. Yeah. Today you're expecting to have Minister of Health. What is happening?
Yeah. Before I reach there, the doctors are also on strike. The ones who are fully employed are also on strike. And I think not all of them are on strike. Some are on strike. Some have moral obligations, so they have not gone on strike. We also have lecturers from Gulu University who are helping us. For them, they cannot go on strike, of course. They are doctors, they are teaching, they cannot go on strike. So that is what that is the cover-up they are doing for us. However, the Minister of Health is coming to launch to launch vaccination in this region.
Okay.
COVID vaccination in this region.
Okay.
I urge everybody to come, attend, and then also take up the vaccination. We have proven that it works.
Okay.
Yes.
Thank you so much, Dr. James Lima, for speaking to us this morning. We definitely appreciate it.
Yeah, thank you very much.
Mildred and Simon, you've had doctors that are saying a profit 2.5 million is okay for intern doctors. It's a discussion that we are going to have. Of course, we are having the Minister of Health, Dr. Jane Ruth Cheng, here, and this is the same question we want to ask her. Will government hear out? Will they have another dialogue apart from the one the President did with the leadership of the association? Is what we are going to put to the Minister. Simon.
All right, thank you very much, Benson Ongom. Are these threats still important?
Well, in such crunch moments, the least you would love to hear is someone threatening.
I think we would now
the last thing you do is to threaten a doctor.
We would not be throwing threats, but we would rather be appealing and asking the doctors. At least remind them of their Hippocratic oath, not threaten them.
Even reminding them now would be farcical, would be ridiculous, to say the least.
Probably you could use that to persuade them back.
No. You don't persuade me. You persuade me with a promise of better. But when you remind me, it's like telling a hungry person that, you know, there are restaurants out there.
You know, Simon,
but this person cannot afford it.
One of my most interesting comments was from one of the doctors on Twitter who said, this thing of reminding us about the medical field being a calling, it is not. Some of us did not come because it's a calling, but because it was the option.
You can't spend 6 years at university
yes.
and then someone arrogantly comes and tells you
it is
a calling.
Okay, yes, it could be a calling, but please, it is a calling that talks about life and death. It's a doctor between your life, yeah, you living and you dying. Of course, God above all. But if a doctor is not upstairs, I would say, for lack of a better word, not settled, how do you expect them?
I want to borrow the statement Moses Mulumba made the other day.
Yes.
That we should stop treating public servants like missionaries.
Yeah. That missionary service.
There is always that excuse that, you know, you're in there for a calling. You're teaching because it's a calling. Why are you in Chikubo when I'm teaching?
Yeah.
Okay, Chikubo is also a calling. Everything is a calling.
I agree that we need to stop, you know, stigmatizing people because of their professions and then reminding them, and yet they're talking about aspects that need to be sorted. But Simon, let's go to talking culture and talking our origins. My biggest problem in Uganda now is that this is what we were talking about. That people have been, I think, radicalized in their minds. That even when you come up to speak fancy about your culture, about your religion, your region, you're termed sectarian, you're termed promoting politics and tribalistic.
And these things have not just come. I think this culture has been around for about 15 years. Today, if you come out to say, I'm a proud Muganda,
you're considered tribalistic.
You're slapped with that insult of tribalism.
But because, what do you zero down to from Uganda? What is the smallest unit that you would go to? It would be your tribe, it would be your region, it would be your ancestral, you know, background and attachment. I am proud.
Can I break down the things that define me?
Yes.
Tribe, religion, tribe. And nation, in that order.
Yes. And then
I am a Catholic, Ugandan,
then East African, then African, then you become a global citizen.
East African, I'm not sure.
But you're in East Africa. For whatever reason, you're in East Africa. So
and I have contestations about my Ugandanness.
Why? Because some colonial master used the ruler to draw.
Ugandan? If you can explain.
Well, you're in Uganda at least for starters. Do not ask me to start educating you on what makes you a Ugandan. You should know.
But I have an ID that expires.
Yes. Everything, even life expires, Simon. Life itself expires.
So what will happen in 2020 something?
You go renew.
When my ID is expired.
You go renew. Because at that point in time, you might have even chosen not to cease being a Ugandan. And you want to become some other, nationality.
I can choose not to be a Ugandan.
Yes, you can choose not to, but you will still remain by birth. There are things that can never change, and that is the reason why you're Ugandan.
Interesting.
But well, let's go to the Ekyoto Hampango, which is, in high gear. And if I could remember, Ekyoto Hampango. Can you pronounce that quick?
Ekyoto Hampango.
Exactly.
What does it mean?
Julius Nabimanya. Simon Kagwanjala would like to know what Ekyoto Hampango means.
Take me to school.
Take him to school.
Midwid, let me respond to Simon Kagwanjara in Rutoro. Ekyoto Hampango no mukoro gwa kirabasege ntari ya Toro ogwa kutekaniriza abantu be ombukamabu. Simon obikengire bimbarizi. Konka, we are coming to you live from Muchwa, the Parliament of Toro Kingdom, where the Ekyoto Hampango celebrations are taking place. We are in day 2. Ntari ya Tora simire yampiga twariri ya makuru Vincent Mugume. Tubaze nawe this morning. Nkutangirira rari.
Wachamuna keke. Good morning Uganda, good morning Fort Portal, good morning Toro. Royal greetings to you all. Yeah, this morning we're in day 2 of the Ekyoto Hampango Festival, and day 2, the royal tours continue. And later on in the day, His Royal Majesty will be here, exactly where we are standing, to officially launch the Chota Mpango celebrations. And later on, in a bid to ensure that his people live a healthy life, the King will launch a vaccination drive in the kingdom, and all the Masazas in the kingdom will have this drive to ensure all the people are vaccinated against COVID-19. And also we see the King will also hand over more than 30 oxygen cylinders to all the hospitals in the entire kingdom to ensure that in case there is need, his people are attended to.
Burut karora sirinda umkama na tekaho sirinda kabarore hospital na teka hirwaro abantu bebona bakugenda genda. Ezo nizo sirinde zikuzagenda hano.
Exactly. Those are the cylinders that you're going to give out later on this day.
Then take us through tomorrow, how tomorrow and the other day will be.
As you can see around here, the exhibitions will be going on. Abantu bijokwa niboleka what they will be showcasing bike vainaho ebintu byamani ebintu ebirungi ebyabantu batora abantu ba Uganda ebaseme kwa nibarora ngo muntu baruga hona horugiro okaija tor kike kyoseme kuba norora. These are some of the things that you will be showcasing later on in the day.
No, it's okay to bazortoro at fort poto ni bintu kye byokurimo nkatoro ntwegondeza
bintu vingi muno orambagamba toro ko kaseme okwija mu ruga rwa Fort Portal obwomezi obulungi obulhano enyikara y'obwire ebijongo amahoteli amarungi hospitality okutangira okurungi ekikali kyaitu bingi muno tisokugamba byona nkabimarayo nabwekyo ogwange gwo kubaraliza inywena abakuturora nayo Mildred hamna mtayi wao mwija toro oranetaga kuba no humuraho ija omukendi hano mtoro
webare muno alari webare muno
ote muna kiki webale kundaliza okwija kwa
Midrid bino nibyo birahanu aharubugo rukuro rwa toro Simon, I doubt whether you have got what we have said.
Liberate to make me lost. But never mind. At least someone had you. If you are...
I will interpret for Simon, don't worry. Baitu, akik no kiali genda, biki abindi bitukunihira kubani bigenda maiso hampango. What other activities for Simon, at least to get to understand, do we expect as this goes on?
Midweek, as you have heard that today there is a vaccination drive. There is also the giving out of oxygen cylinders. And recently we saw the King Oyo launching the construction of oxygen plant at Kabarore Hospital. Today we'll majorly focus on health, and then tomorrow, I think let's talk to
the
him
exhibitions,
again. Abantu banhirech tomorrow, abantu banhirech barasange hano.
The exhibitions will still continue. We'll continue here at Mutual Palace, rather Kingdom Parliament, and also youth engagements, sensitization workshops, the clinics, the agricultural, business, hospitality. We want to ensure that when our people come, all our visitors that come to Toro find the first-class professional services. So we've teamed up with so many organizations that have come around to equip our people in different sectors so that they get equipped with first-hand information on how to do some of these things. Talk about agriculture. Later on in the day, this morning, Singa Navio will also be sharing his knowledge about agriculture with the youth in Toro. Thank you.
Midwidi ebe byonu byo birahano mu Rutoro konka hata mukoro guno tutaireho timu zaite za Burhamu ntwenda kubahereza buri kugenda hano live abo kuba hatitwe nka NBS tukacwamu buri kimu tukibahereze cya Toro live nko kutukora. Simon Midwidi anyambe hakusobora ibintu bine binabazo
ningia kumsoboro tafai webale mna kiki, and of course thank you for giving us what's happening in Toro ekioto hampango nikigenda maiso and Simon nkagamba boraba no yende mpako.
What kind of acclamation do we give to the Toro King? Like we say, agunde gunde aisawa.
Hangiriza gutamba.
I thought that's for Bunyoro.
No, Bunyoro and Toro are not really very different. As a matter of fact, hangiriza gutamba. Because that's the same acclamation we give to the Bunyoro King. And that's why they have the same titles, Omukama. Because in essence, Batoro are grandchildren of Banyoro. Not grandchildren, but they're from the Banyoro. They're literally the children
Luganda
of Banyoro.
Agunde gunde aisaba.
And in Runyoro, Rutoro,
we say
Afumvue.
No.
That's what? What is it? I know you have
that
some.
That one means something totally different.
Maybe our camera person, Agre, will help. Will help with what is the
Afumvue.
I said that's exactly it. That's it.
Afumvue is safe. That's Busoga.
Exactly.
So ekisegese ekitalibwa nsete. Do you know nsete? Nsete are termites.
Simon, I know your coordination or your connection to Busoga, and I am loving the fact that you are paying attention to that. Well, and then Runyoro Rutoro will say,
nice people. They gave me a wife.
Yeah.
So Hafumvue.
that is your connection. But just before we take a break, and like we were saying earlier on, sometimes we just need to celebrate who we are and celebrate our
and
culture.
Take a break from radicalism.
Thank you. Simon, I will have you sing the Buganda anthem. You'll just do the chorus and the first verse.
I'll do it with a lot of ease.
And it's not sung while, and you know my respect for Buganda.
Yeah, okay.
So I will definitely have to stand up as we get Simon to sing the Buganda anthem.
Which key do you want? C, F, or flat?
Sing whichever key.
Or flat. Okuvetane deriona line gwanga Buganda lyamanyi wanyonge gwanga lya fe okwetolola ensi yonna twesimye nnyo olwa Buganda yaffe
ekitiibwa kya
Can I sing alone? Ekitiibwa kya Buganda kyava da naffe tukikuumenga. Take us to Bunyoro.
Bunyoro kitara tukugonza nyina itwe itwabana beihanga abakutama kitinisa lero turakoraki tukugize Mukama nitwijuke kitinisa kyeihanga lyaitu Bunyoro.
No wonder we brought you over to Buganda. You're such a gem.
Because yes,
lovely,
yes.
lovely. Awangale Aisha. We need a break from
Hangiriza Gutamba, and we'll take a break. But when we do return, definitely, our discussion will be going back to the NSSF. Now, officially, the amendment bill is passed.
By the way, I'm excited about it. Ask me why. I've been agitating for this for a while. We need to eat our money when we're still alive.
But do you expect that the president this time will be assenting to it? Because remember the first time that the 10th parliament passed it,
that's
he had a bit of reservations, especially with the management having it under the Ministry of Finance. But Parliament has clearly come out and said, no, we cannot have it under Ministry of Finance. But at least I know that Section 31, which deals with, borrowing and being able to invest, is going to be, Clause 31 is going to be under the Ministry of Finance. Also, when you look at Clause 32, which talks about auditing of the fund itself, that is going to still remain under the Ministry of Finance. Issues of, aggregating an interest rate at the end of the year will also be under Ministry of Finance.
Is there a clause in the amendment that would allow us at least to share some of the profits around Christmas time?
No, not around Christmas time, but at least those profits will be put into, as always as it has been, they will be put into a particular percentage.
No, we should make it
interest
simple.
Rate.
It should be compelling
that's
for
given
me
to you
to save with NSSF.
You don't save for Christmas. If you want to save for Christmas, funaka box. That's basically it. But more about the NSSF Amendment Bill
You're not
shortly after
kind.
this break.
Good morning.